Today, we're going to talk about Scrambler Therapy, which was also known as Calmare. I've never done this treatment. I will present the information on how it works and have guests explain their personal experiences. According to a paper written by Johns Hopkins in 2023, Scrambler therapy has been approved since 2009 for chronic pain. Scrambler therapy provides relief for 80 to 90% of chronic pain patients. Scrambler therapy is far more effective than a TENS unit. A TENS unit is a transcutaneous electrical nerve stimulator. Electrodes are attached to the skin, and an electrical current is emitted, and it works on a small area. Scrambler therapy administers electrical stimulation through the skin via electrodes placed in areas of the body above and below where the chronic pain is felt. The goal is to capture the nerve endings and replace signals from the area experiencing pain with signals coming from adjacent areas experiencing no pain, therefore scrambling the pain signals being sent to the brain. Almost all nerve and neuropathic pain results from two things: pain impulses coming down from the damaged nerve area that send a constant barrage up to pain centers in the brain and spinal cord, and the failure of inhibitory cells to block these impulses and prevent them from becoming chronic. In CRPS, we know that pain is caused by two things: neuroinflammation from the glial cells and NMDA receptors, and a constant barrage of pain signals being sent up the spinal cord to the brain. From the NIH, Scrambler Therapy, abbreviated ST, is a non-invasive method of neuromodulation that is applied through electrodes on the skin and can alleviate chronic neuropathic pain by stimulating C fibers and replacing pain signals within the body with synthetic signals. Although the use of ST has been reported for several types of refractory central and peripheral neuropathic pain, there's a lack of data regarding the use of ST for complex regional pain syndrome, according to the NIH. So back to what is CRPS parts 1 and 2. CRPS involves neuroinflammation caused by the NMDA receptors and glial cells. Pain signals run up and down the spinal cord to and from the brain, causing things that would not be painful to others to become painful to those with CRPS. Scrambler therapy changes the noxious pain signals by replacing them with non-noxious pain signals. An article in Pain Medicine, March 2023, looked back on the records of those undergoing Scrambler therapy, looking for safety issues. The results of the study showed that when used in accordance with the treatment protocol described by the U.S. Food and Drug Administration, the device manual, Scrambler therapy is safer than surgically neuromodulation devices such as the spinal cord stimulator. Scrambler therapy neuromodulation is a safe alternative for patients who cannot undergo invasive neuromodulation device implantation, either because of risk or preference. Because no surgery is involved, the Scrambler therapy is a safer option than the spinal cord stimulator. Spinal cord stimulator, at best, is a temporary relief. It seems to be about a 3 to 6 month period when it is optimally effective. The spinal cord stimulator functions like a tens unit machine, which emits a single current. The Scrambler Therapy technology offers 16 currents, which consistently alternate so that no one sequence is repeated during a treatment. This variability prevents the brain from learning how to tolerate it, as with the spinal cord stimulator, and therefore will not accommodate to it. So the pros: it's non-invasive, no surgery is involved, has no painful side effects. It doesn't involve any pharmacological use, and it's cleared by the FDA. The cons of Scrambler Therapy are, even though it's FDA approved, insurance does not cover it. The cost, according to the Pain News Network, is about $300 a session. What to expect during Scrambler Therapy. The Scrambler device disrupts the pain signal by using electrodes similar to the ones used for an EKG that are carefully placed near the area or areas of pain. The device produces small electrical currents. The currents activate the C fibers, producing non-pain signals that override the CRPS pain-generating signals. Treatment outcomes are highly dependent on the operator's ability to correctly identify electrode positioning areas and the fine-tuned stimulation intensity. When the procedure is carried out correctly, pain is zeroed out immediately, and the rest of the treatment is automated. The length of the treatment: people generally undergo 30-minute sessions, and the number of sessions is usually 10, Monday through Friday for 2 weeks. Like some other treatments for CRPS, you may need to repeat the treatment in the future. And this is what it looks like. Important things to consider. Talk to others with CRPS to see if it helped them and the name of a practitioner that they used. Do your homework on the practitioners. Who you choose to provide your Scrambler therapy is very important. If not done correctly, it may not work. There are some people who are non-responders. Scrambler therapy can be followed by physical therapy after your treatment in order to improve mobility and strength. Hi, today we're talking with Sandy about Scrambler Therapy. This is something that I know very little about, as I've never had this as a treatment. So, welcome, Sandy.
Thank you. Glad to be
How,
here.
how did you choose this treatment for your son?
Okay, so my son was very young when he was diagnosed with CRPS. He was in his early 20s, and so we kind of learned about the different things that were out there. The traditional things like nerve blocks weren't working for him with any long-term relief. And there were other things that he was very averse to. He was averse to, like the spinal cord stimulator. He did not want that. He did not prefer ketamine because he'd had it before in a couple of intravenous protocols, along with different procedures to kind of help prevent CRPS spread, and he did not like the way it made him feel. And so, what I was really looking for him was something that would be non invasive and very safe. It's Scrambler therapy is non invasive, non narcotic, and it treats CRPS at the root cause. And so those were the things that drew me to this therapy for him.
And how did you choose the doctor or practitioner who would administer the therapy to him?
So at the time that he went, he was, there were as many providers as there are now. And so we live in Texas. There was a provider in Texas. Their machine was not available at the time. And so I just started researching who was the best provider in the country. And so I thought if we're going to have to travel, we might as well go to the best, right?
Hmm.
And so I called around and started looking. I asked a lot of people, providers that they went to that worked. And I found Dr. D'Amato in Florida, who is the most experienced practitioner in the nation. Now, at this point in time, this is 3 years ago or 2 years ago that he went, there has been a lot of expansion of the offering of this capability. And so there are more options for people. But what I always tell people when they're exploring this is that what they should do is they should call and talk to the doctor specifically about the training that they've had and the
Hmm.
experience they've had, and specifically what experience do they have with that condition,
Right.
because that is very, very important in terms of the success of the modality. This modality is absolutely reliant on the experience and knowledge of the practitioner.
And it's something that is not covered by insurance.
It is not covered by insurance in general. I will say that. I do know
Okay.
people who have petitioned to have it covered and have been successful.
Oh,
But by and large, I always tell people go into it expecting to have to pay for it. And then if you get reimbursed for at least a partial amount, I don't think anybody will ever get, just the way insurance works, I don't think you ever get the full amount of your money back. But I think if you can get a partial reimbursement, um, I think that's a win. Now,
yeah.
I will say this, I do want to clarify for
Hmm.
people because when I went into it, that was one of my biggest fears too. I was like, how am I ever going to afford this? Because I knew I was going to have to pay for it out of pocket. And so it's not in the scheme of life. I know it's a lot of money, but in the scheme of life and getting your life back, it's not that expensive.
Right.
You could expect to pay anywhere between $2,000 and $4,000 for this therapy, all in. That's, going from getting your evaluation all the way through the course of treatments. And then if you have to travel, you would have to factor in travel costs.
Right. So, can you tell us how Scrambler works?
Sure. So, like I said, Scrambler is non narcotic and it's non invasive. And so, what the practitioner will do is they will use surface electrodes. So, think in terms of um, like what you would see with an EKG or a TENS machine. Now, this is
Hmm.
not a TENS machine. It looks like the pads look like a TENS machine, but that's really, and it uses electricity. Those are the kind of two things that it has in common, but it's a very different application than TENS. So, what Scrambler does is they use surface electrodes, they apply them over what's called a dermatome, which is kind of like a place in your nervous system where the nerves branch off and the nerves go and cover a specific area of your body. So they target the area of your body where you're feeling symptomatic. And they place those or those pads over the dermatomes, and then it sends a very gentle electric signal. There's two of them. They create like a loop that the signal goes through, and the signal goes through those pads and up into your brain. And when the signal reaches the brain, the electronic signal that gets sent through that loop reaches the brain, it is interpreted by the brain as being non-pain. And so that non-pain signal repeatedly hitting the brain retrains the brain to let go of that pain pattern that the brain has developed. And it's done over 10 days so that your brain can fully form that habit. And it's incredible. Like when they first hooked my son up to the machine, of course he had been in pain at that point for almost 2 full years.
And he's was full body at that point.
He was full body. He had a full array of symptoms. He was one of the, I've seen some bad cases, and of course it's not a competition,
Right.
but his was about as bad as almost anyone's I've seen. But when they hooked him up to that machine, he was in zero pain for him immediately. It was an immediate thing. That does not happen for everyone. Some people take longer. That's okay. That's normal. But for him, it was the first time he felt no pain. He immediately fell asleep, immediately, because his brain felt safe again. It was absolutely incredible. As a mother, I just sat there and cried because it had been, so long since I'd seen him comfortable.
Yeah. Um, so you answered my next question.
I did, because I know you're going to ask how long. Okay, so he had 10 treatments.
Okay.
So that is the standard protocol. Some people do require more. So I think that's important for people
Yeah.
to
And
know.
in general, do people have to repeat it?
Some people do. Some people go in and they get regular maintenance treatments. I don't think that there's a normal to this. For him, I'll tell you his story, and I can tell you a couple of stories of other people I know.
Sure.
With his CRPS, he actually developed a whole host of like acute situations that came along with his CRPS. Three of them required surgeries. Um, After his the first surgery, he just sailed through. He was totally fine. The second surgery was on his same leg that his CRPS was on, and
Mhm.
it did reactivate his CRPS, even though we followed the surgical protocol and all of that. And so, as a result of that, we went right back. We went to Scrambler. Only took 5 days the second time. Excuse me. And then he went right back into remission after that.
That's awesome.
So in 2 years, he had a third surgery in January of this year. He wasn't like full on out of CRPS or out of remission at that point in time, but I did take him back again because I wasn't taking any chances.
Right.
So that was a personal choice. But I do think there are people who, it doesn't last forever, and so they go in periodically. Other people I know, they're going on 2, 3 years and they haven't come out of remission yet.
You
Um,
know the average length of time that the people that you've met have had CRPS? Like you said, your son had it 2 years.
yeah, so I don't even know if I could say an average, but I will
Well,
say I've known people who
general.
have
Yeah.
gone in immediately after they get diagnosed very quickly. They learn about Scrambler therapy very quickly, and they can just go. And then that's a great scenario. I know another several people, they're 20-year plusers. That they just didn't know it was out there. They didn't know it existed. Other people, a year, 2 years. I seem to know a lot of people in the 1 to 2 year range.
Right.
Um,
Well, people are
and
being diagnosed, in my observation, much more quickly because the average used to be 2 years
yeah,
between incident and um, diagnosis.
yeah. Connor was diagnosed almost a year after he had his initial surgery that caused it. No, I take that back. Almost 2 years. It was a year and 9 months.
Yeah.
It took us another year to get him to Scrambler
Mhm.
because he had so many other things going wrong, and he was on medication. He was on a lot of medications, and there are some medications that are contraindicated to Scrambler that you need to be off of in order for your brain to have like a clean palate to accept that
Such
signal.
as classification.
So a lot of like the ketamine,
Right.
gabapentin, Lyrica, those classes of drugs,
Okay.
not just those specific
Right.
drugs, but those classes. THC is contraindicated. It would also be contraindicated for like an individual who has an implanted device.
Mhm.
So I, I've heard there are some places, primarily like in Europe, that if you have an implanted device and the device is turned off, they will do it. The US doctors don't seem to want to do that because of the liability.
Yeah. All right. Well, thank you so much for your time and your knowledge.
You are
And
welcome.
I appreciate it. Thank
You
you.
are welcome. Thank you.
Hi, today we have Ashley with us. Ashley, can you briefly tell us how you got CRPS and when?
So, yes, I twisted my ankle back in sometime in February. It's 2024 of this year. And then I went to Disney and I walked on it, and it was like one of those twists that you really don't even think anything about. And someone had to be like, think hard. Did you do this? And I was like, actually, yeah, I did. And went to Disney, had a day of where I almost hit the ground because my foot was hurting so bad. And then walked on it for 2 more Disney days because I am Fun Aunt Lala, and Fun Aunt Lala does that. So I came back home, kept getting worse, kept getting worse. I'm not a person that really slows down, so waited probably a few days longer than I should have. Went to Doc in the Box. Doc in the Box was like, we don't see anything, but we don't have the right imaging, so just get off of it, rest it. If it gets worse, go to the emergency room. Went to the emergency room. They sent me straight to ortho, and then I was diagnosed with stress fracture in my heel, plantar fasciitis, and bone spurs.
Mhm.
So after diagnosis, got off of it completely in a boot, kept getting worse, kept getting worse, kept getting worse. My ortho doctor was like, let's do an MRI. Got the MRI. The MRI was extremely painful, and I think that that was the first sign of CRPS setting in my foot because I had a weight on it.
Right.
MRI showed that the gastroc muscle had shrunk and needed to be released, and that I had a tear in the plantar fascia. So we scheduled surgery. Before surgery, I really don't know how to explain it other than to say I had a constant squeeze event,
Mhm.
and it came out of nowhere. And called the ortho's office, and they were like, well, we don't want to wait until surgery. A few days from now, I'll go to the ER. We're afraid you have blood clots. And didn't have blood clots. They diagnosed me with a spasm. The spasm did not end until surgery. And the surgeon and everyone that came in the room with surgery was like, we don't understand that you're as sensitive as you are to touch. If I would have my leg dangling down, it was like my blood pressure would shoot up.
Yeah.
And then a couple of weeks post-op, went and saw the surgeon, and he's like, this is not what this is supposed to look like whatsoever. I think it's one of 3 things, because he's never had a patient get CRPS, and he
Right.
is, I would say he's probably been a surgeon at least 15, 20 years.
Right.
So, and he sent me down to the ER. He thought it was MS, lupus, or something was wrong from the surgery, but he's like, I want an emergent MRI just to make sure we didn't miss something because your surgery was textbook. Like, okay. I want to be super common when it comes to things like that. And then ER didn't find anything. They sent me to my GP, and my GP actually wasn't available to see me for like a couple of weeks, but I was able to get in with her nurse practitioner. And the first thing that she said was, this looks like CRPS. So truly my first doctor's appointment was enlightening with that. And then it's the Budapest criteria, check, check, check.
And it encourages me so much because not only you, but several other people that I talked to were diagnosed so quickly.
Mm-hmm.
2 years for anybody to figure out. And that was the average prior
Mm-hmm.
to, I would even say prior to this year.
Yeah.
So
Yeah.
let's talk about your Scrambler treatment.
Mm-hmm.
You did it to treat the CRPS. Can you briefly tell us about the treatment and
Mm-hmm.
why you chose to have that as your treatment?
Yes. So there's all kinds of treatment options out there. I have, through this, I now get full body tremors when
Mhm.
I get any kind of needle involvement. So that was big for me to find something. And then I read several books, and everyone kind of was talking about Calmare being an option. So did a deep dive on that, and I'm in Alabama. I was fortunate enough to find a place that's 2 hours away, so it's 4 hours round trip. And Calmare Therapy basically is Calmare Scrambler to me is synonymous.
It is.
So it scrambles the pain signals that are that constant firing, constantly getting worse and worse and worse, to kind of dissipate that pain loop. And so it's been extremely helpful. It has uncovered other issues that I'm dealing with this. And so I had a brief pause, but I'm back in the Calmare therapy now. I go back tomorrow and I've got 2 more sessions. I decided to do 12 instead of the recommended 10. Simply because I did have a little bit of a, hey, I need to find out all of these other diagnoses because it's
Believe me,
the other pain that is happening in my body that you can't hear over the CRPS. And then we're all in this seat hoping, praying to find remission. And if I'm having, so part of what's going on now is I've got deep edema swelling. And so basically I put my foot down and it swells almost instantly. And so I'm very fortunate in the fact of getting to diagnosis. My leg is a very specific CRPS looking leg.
right. And
so
it's gone nowhere else other than the leg, right?
Yeah, it will
Because
send.
you caught it quickly enough.
Yeah, and it will send signals. Like the bee stings can happen anywhere. The fire ants will go anywhere. But like what feels like my toe is getting sawed off, it's staying in that foot. The hammer. So sometimes it'll feel like I'm getting hammered and it stays in that leg. So I'm fortunate there and really trying hard to get it before there's any kind of spread because that's terrifying.
And I'm just mentioning this for the audience that this is not covered by insurance.
No.
It's a cash basis, even though it is FDA approved.
Yeah. And on the other side of this, I really want to get involved with the legislation behind that because where you're great medically, I'm good paperwork.
Yeah.
Yeah, because it's just to me the things that I have found have been more effective have been the things that aren't covered by insurance. And I've had 4 MRIs, CTs, I don't know how many x-rays, ultrasounds. Like I've had 4 emergency room visits with this. Like it's not like if the insurance companies could just look at it as a whole, they would see I would be saving money if this was something that was covered. I'm currently with the CRPS pain. It's really hard for me to ever say 10 because the pain scale is so different. But today I'm sitting at a 3.
That's awesome.
And that's a huge victory over like a constant 8.
Yes. Well, thank you so much for your help.
Absolutely.